Hello, my name is Dr. Alice Fong, and today I have the pleasure of introducing my good friend, Dr. Charles Andrews, who's also a graduate of Bastyr University. We went to school together, we studied together, and now he's based out of Puerto Rico. Dr. Charles Andrews is currently the clinical director of the University of Turabo here in Garabo, Puerto Rico. He has led the development of integrative and functional medicine in a hospital system in Kansas City and right here in Puerto Rico. So today I have the pleasure of introducing Dr. Charles Andrews. Welcome, Dr. Andrews.
Thank you,
How are you
Alice.
doing today?
I'm doing well.
All right, wonderful. Great. So let's get started with, how did you get into integrative functional medicine?
Yeah, well, I think as a youth, I wanted to choose something in a career that I believed would help people in general.
Mm-hmm.
Later on, my mother passed away from breast cancer, and she was really influential in me looking for alternatives to healthcare problems. And so I found naturopathic medicine at Bastyr University, and that's kind of where it all began. Got married, had a family of my own. I started a private practice in the Kansas City area, and then the process of my journey took me to a healthcare system that was looking to create solutions for individuals who weren't responding to conventional medicine, and they wanted to create a functional medicine clinic there. So that was kind of exciting, and that took me to where I am now. I'm continuing to do that just in other parts of the world.
That's amazing.
Yeah.
Awesome. Great. So now, as the clinical director of the University of Turabo in Puerto Rico, how do you see the impact of the hurricane recently for the patients that you see?
Yeah, well, in general, there's a lot less care available. Many of the doctors left the island after the hurricane, and there was a greater need. One of the strategies that we came up with right after the hurricane, the hurricane hit, almost everyone was without power, and I was thinking about our medical school here and our center, and I was thinking, well, we have a generator that can operate independently of the public power, so we can offer services. There was only one other hospital open in Caguas. Some of the emergency rooms were still closed. A lot of the laboratories were still closed. So we just decided, we are just going to tell everyone we're offering medical services. We offered free medical services for about 3 months, free of charge. We put up a big sign, and we were just overflowing with people. We'd never seen that many patients here in a teaching clinic before. And we realized that we had a capacity to help a lot of people, and there was such a great need.
Oh, I'm sure. Yes. What kinds of conditions did you see people come in with after the hurricane?
Yeah, immediately. Well, right now we have doctors of various capacities. There's doctors who focus on women's health, a lot of pediatrics. We see a lot of autoimmune disease, a lot of chronic disease, children with ADHD, but immediately following the hurricane, there were individuals with hypoglycemia. There were individuals with a lot of stress.
I'm sure, definitely.
Mood disorders, depression, and a lot of pain. I think there was a lot of stress-induced pain.
Makes sense.
So there was some pain management going on. And a lot of that was the biggest thing. And there weren't any counselors available. We wanted to refer people to counselors, but their phones were busy because the phone lines were down. And so we were seeing a lot more of that than we usually do.
Wow. Yeah, I can understand that would be a stressful time for a lot of people to have to deal with that and not know what's next for them. And to be able to offer that service is an amazing thing that you're able to do and open a clinic and offer free services for people. And I was just curious, what was the impact of the hurricane on yourself and your family?
Yeah, it was, my kids were happy that they got to stay home from school and play with the neighbors all day long.
Of course, yes.
And, it was challenging. We didn't have water for approximately 3-4 weeks.
Wow.
And we were without electricity for 59 days.
Mm.
But there were some good things that happened. We saw a lot more of our neighbors. We hung out with our neighbors. We even shared food. And one of our neighbors had a generator that he turned on, and he got a signal for the local news. It was exciting. He set out his TV on his front yard, and we all sat in some lawn chairs and kind of chatted and laughed together and watched what was going on in the world, since we hadn't seen anything that was going on in the world for several weeks. And so there was a bonding time, but there's no one that was left unaffected by the hurricane.
Yeah.
And individuals lost their homes. For me, my family left for the United States after a few weeks, and that separation is always challenging in any family. So there was no one that wasn't affected.
Definitely. Yes. And what would you, so there's so many people in the world without access to healthcare or any access to doctors, and it's amazing that you are offering that through a teaching clinic to offer some sort of medical services to people in need who don't have the means to afford to see a doctor or have a car to even drive to the doctor potentially. What kinds of things would you suggest to these people who have limited resources and funds to access medical services?
Yeah, first of all, I want them to know that there are lots of options. They have lots of options. Just going back to the time when I was in Kansas City in the hospital system, we would contract with laboratories and offer really cheap pricing for laboratories for people who didn't have insurance coverage. We even knew several imaging centers that offered very comparatively affordable rates for MRIs when they weren't insured. So there are options that people are able to pay back in their lifetime. Oftentimes there's a lot of fear, like I'm never going to be able to pay off.
Right.
But somehow you got to find them. You got to know the people who know those options. So
Yes,
there are. So don't give up, and you will find someone who can help you. Locally here on the island, what I really like is there are so many organizations and so many doctors, especially within the naturopathic medicine field, that are providing free clinics around the island. Currently on our website, we announce when these community events happen, where doctors go around and provide free services and free assessments. Our website is www.clinicanaturopaticapr.com or clinicanaturopaticapr.com. And we have a calendar of events where there's several organizations. There's doctors that are called Barefoot Boricuas that go to various cities on the island every month and offer services. There's another organization with the Boike that also goes and offers services, and there's another ND Community Service. And the University of Turabo's medical students also show up at various events. And all of these are free. And we often find if there's an individual who notices that there's not a health fair or community event health event in their community, they can contact us, and we're very excited to be there. Oftentimes when somebody from the community asks us to do it, they also help spread the word so more people can show up and take advantage of services that are absolutely free.
That's amazing and awesome. And it sounds like a very symbiotic relationship in that you're helping students learn and grow from offering these free services to people in need, and then these people in need of these services are getting help at no or little cost, which is so wonderful.
Yeah, I'm glad you brought that up. I remember reading a long time ago, I think from 7 Habits of Highly Effective People, that the best scenario is a win-win solution between both. And you're right, students need to learn,
right?
And people need to get better,
Exactly.
and we're all benefiting. It's not one way. It's not just the patients are benefiting free services. It's everyone benefits.
Everyone benefits and learns, and then we can grow as a profession and help more people if we're able to learn more and get more exposure to different conditions.
Yeah.
Under supervision, of course, of a licensed doctor. Yes. All right, wonderful. Was there anything else that you felt like would be important for people without access to healthcare to know this time?
Usually when I have a client that comes in and they feel desperate or even hopeless,
Yeah.
I usually try to convey to them that there is hope. Don't give up. Don't or keep looking and have hope and try to enjoy what's going on, and you'll be led to the resources that are out there.
Wonderful. Well, thank you so much for sitting down with me, Dr. Andrews, and it was a pleasure. Thanks for watching, everyone, and check out Dr. Andrews' website or the clinic's website if you need services in Puerto Rico. Thanks.
Thank you, Alice.
You're welcome.